Deputy Donnelly.
Thank you, Ken Corlett. Taoiseach, we hear that at Cabinet yesterday a proposal to allow GPs opt out of the scheme to bring free GP care to the under 6s was discussed, and today Dr Ray Wally of the IMO has described the scheme and the government's approach as courting disaster. Now, I and other TDs recently met with a large group of Wicklow TDs who explained the proposal as a mistake. They explained, Taoiseach, that there's no extra capacity to deal with the extra visits that this policy will inevitably result in, and as a result other patients with more pressing medical needs or financial needs will either not be seen or will take a lot longer to be seen. They predict that children will be brought to them as GPs who don't need to be, leading to other people who do need to be seen not be seen. And they couldn't understand, Taoiseach, why the under 6s as a group are being targeted ahead of those who either need medical care more or cannot afford medical care. Now, Taoiseach, what your government is doing doesn't make any sense to me. With one hand, you're clearly taking medical cards away from people who desperately need them, and with the other hand, you're going to give GP cards to many people who don't need them. Now, what the GPs are saying is this is going to lead to yet more waste in a very wasteful healthcare sector, and it's going to lead to GPs seeing people who don't need to be seen and therefore not seeing patients who do need to be seen. It's very clear, Taoiseach, that the GPs were not consulted in any meaningful way as this plan was put together, and the scheme and the approach that the government has taken to the scheme is further alienating a GP population that is crying out about what is already happening in primary care. Taoiseach, the GPs we met pointed out that there are very few young GPs entering the sector, that 3 out of every 4 graduating GPs in Ireland are emigrating, and that the GPs who are here are advising their colleagues not to come home because of what is happening in primary care and general practice in the country. They explained that the HSE embargo has further exacerbated this situation and pointed out, for example, in Wicklow there's now a 6-month wait for physiotherapy appointments.
Thank you.
So, Taoiseach, my question is this. Based on common sense, based on what is happening where medical cards are clearly being taken away from people who need them, and based on what appears to be a very solid consensus from the general practitioners, do you agree that this scheme should be shelved and that the money in healthcare should be directed not in a carte blanche approach but to those who either can't afford the care or most badly need it? Thank you.
Thank you, Deputy.
No, I don't, Deputy Donnelly. You're wrong when you say that this matter was discussed at Cabinet yesterday. There was no discussion about under 6s or GP care at Cabinet yesterday. I might say that the government made a very clear decision here, Deputy Donnelly, to introduce free GP care for under 5s in 2014 as the first of a number of major steps leading to universal health insurance. Every parent, every grandparent knows the costs of dealing with family life are very expensive now. Mortgages, burdens of creche fees, doctor's visits, other things. All of these hard-working parents of 240,000 children will now have the reassurance that they can bring their children to the doctor without having to pay for each appointment. I might say to you that monies were put in the budget deliberately to deal with this. There was an additional separate funding of 37 million put in for the introduction of this particular key reform. It is a fully costed estimate based on current rates of reimbursement to GPs under the GMS scheme, and it includes capitation fees, practice support costs and other claim costs, out-of-hours costs and so on. So it's a very essential part of the movement towards universal health insurance. Was costed by government, will cover 240,000 children, and the parents of those children can have the comfort of knowing that they will not have to pay when they go to their doctor for that GP visit. I might say to you that you're also incorrect when you say that the situation in so far as medical cards is concerned has changed. There has been no change in the criteria for the allocation of medical cards, and extra monies have been included for the provision of new cards this year, as one would expect.
Deputy Donnelly.
Thank you, Taoiseach. I've heard you make the claim many times that there's been no change in the medical card policy, but I think every single member of the House knows that on the ground there clearly is a change. See, Taoiseach, if we go back to Irish Water, the argument is you have to charge for water because it's a publicly provided good, and if it's free, people overuse it. That's the economic argument. So we've got to charge people money for their water. But GP care is a publicly provided service as well. by the GPs, but here we're being told, well, it's now going to be free. Well, we know from recent research that the average number of visits for people who do not have medical cards is 3 times a year to a GP. And for those who do have medical cards, it's 8 times. The GPs themselves are unambiguously saying, if you make this free, I'm not against reducing it, I believe it should be affordable, and right now I don't think it is affordable. But what the GPs are saying is that if you make this free, people will significantly overuse our finite service. So we will have to end up spending time with people who don't need our service, and that will take time and medical care away from people who do need our service.
Thank you.
Now, the GPs are telling us, Taoiseach, that general practice in Ireland is in crisis. 160 million withdrawn from the sector in the last 4 years. And the IMO today said that general practice, as many of them around the country, are on a financial precipice. And the GPs I met have said they've had a 33% cut in public funding and a 50% cut in profits to their general practices. So there's a false economy at work, Taoiseach. I would love GP care to be free. I have 2 children under 6 years of age. But it shouldn't be free for those who can afford it. It should be affordable. So can I ask you, why are you going to direct finite, scarce health services to people who the GPs are saying will overuse it and don't need it, when we are taking medical cards away from others? And can I ask you to clarify, I apologise if it didn't come up at Cabinet yesterday, are you therefore saying that there will be no opt-out for GPs to this scheme? Thank you.
The situation is that I don't know whether the GPs in Wicklow whom you met speak for all the GPs in the country. The reason the government made this decision is very clear. It is government's intention to move to a point where you introduce universal health insurance. The first step in doing that was to move to free GP care for under 5s in 2014. And the reason the decision was made as clearly as it was is that it will benefit 240,000 parents of children who are hard-pressed in very many circumstances with mortgages and creche facilities and other charges that apply as a part of normal family life. The scheme has had 37 million extra allocated to it and takes into account all of the general costs that apply under the GMS scheme for GPs. Now, I'm quite sure that the GPs in Wicklow, who I'm sure do a very good job as other GPs, are well aware of this. And that's the reason that we made the decision. I might say to you that in October last year, there was 1,863,984 full medical cards granted in the country, and another 124,337 had GP cards. That's almost an increase of 590,000 full medical cards since 2008. And last year, the HSE awarded 100,000 medical cards, of which over 23,000 were discretionary. And in this year's budget, there's extra money put in for new medical cards. So the anecdotal evidence that you get is true in some cases, but most certainly not true in all cases.